Hi, this is WGSN-DB going solo. This is a senior citizens forum and sponsored by Benefits for You 2 Insurance Services, and where we specialize in Medicare supplemental plans, Medicare Advantage plans, and prescription drug plans. And I have Cece Shatz back with me again, and we're going to continue talking about those different types of plans. We already, in our part one of this series, we've already talked about how you qualify for Medicare, who qualifies for Medicare. We talked about original Medicare, and let me really quickly, before I go any farther, say that I do not represent Social Security. I do not represent Medicare, which is also known as the Center for Medicare and Medicaid Services. I represent private insurance companies, okay? We talked about what a supplemental plan is, and we talked about prescription drug plans, which had a lot of really good information on it. So please go back and watch our part one of this series with Cece, because it is really good. And you also will get to find out who Cece is, okay? And let's go on with our show, Cece. And all right, so now we're going to start back with Medicare Advantage plans. Medicare Advantage plan combines A and B, and it can include Part D. They're also called MAPD plans. Okay, they are managed health care, and they definitely have a network of doctors. You need to choose, in most cases, you need to choose a primary care physician. Depending upon where you live, you can have a premium. So if you live in one certain zip code area or county, you may not have a premium for your Medicare Advantage plan, or you may pick up a plan that has some extra benefits to it that you feel is valuable to you, and they will have, and that could have an extra premium to it. Okay. They offer many different value-added benefits. And again, the premiums can vary according to region and according to the type of plan that you pick. Now, one of the things that I didn't talk about on the supplemental plan, and I'm going to talk about it right here, is even though you have a premium, you still need to pay that Part B premium. So whatever it is for this year of 2023, that premium is $164.70. You still have to pay that along with your, if it's a Medicare Advantage plan that has a premium, that's an additional premium. If it's a prescription drug plan, you have to still pay that Part B premium. It's very important to know that. And the same with your supplemental plans. Whatever that premium is, you're still required to pay the Part B premium, okay? So let's go on. We're going to talk about enrollment periods, which Cece was talking about enrollment periods a few minutes ago. Well, on the previous show, okay? So the initial enrollment period is a 7-month window. It's 3 months before you turn 65 and 3 months after you turn 65. Or then you have an annual election period. Every year you can go ahead and you can look at your Medicare Advantage plan, your prescription drug plan, and you can review it, okay? And you want to see if those benefits still fit your needs, because you can change A year ago, you may not have had a certain condition. And you may have a new condition, and you may want to be looking at a different plan. So you have from October 15th to December 7th to change your plan, or you can keep what you have. Okay? Now, a lot of people don't know about this period. It's called the open enrollment period. If you have a Medicare Advantage plan and you decide from January 1st to March 31st that you're not happy with the plan you have, or maybe you selected a plan during the annual enrollment period and you don't like it, you can change one time. You have one time to change. It does not, if you have a supplemental plan, you can't change. If you have a standalone prescription drug plan, it will not change. Only your Medicare Advantage plan can you change, and that's an MA plan or an MAPD plan. Then we have the lock-in period, which is from April 1st to December 31st. Then there's special enrollment periods for special circumstances. So say I decide to leave, I live in Los Angeles County, and I want to move to Orange County. I'm changing counties, so I'm changing my zip code or my county. So I need to find a new plan. So I have a special election period during that period of time. And you usually have 30 days before you move and 60 days after you move to make that change. Okay.
So if let's say you were fine, and then all of a sudden you had an accident or you had something that then now your insurance is, you really are thinking about your insurance then, because there's something really major that's happened to you. Can that be a special circumstance within the year?
That could be a special circumstances. Okay. So there are special plans out there to fit that, and you can make a change depending upon what your circumstance is.
Okay. And what is the reasoning to lock it in? So what is the reasoning for them to have this lock-in period?
I don't know. I can't give you a good answer on that.
Because they say so.
Because they say so.
Okay.
I mean, yeah. Here's your supplemental enrollment period. You have a 6-month window that begins on your Part B effective date. So when your Part B went into effect, and that can go into effect at a different time. You can have Part A, but not Part B. And all of a sudden you go and you get the Part B and you decide you want to have it. So they have something that's called a non-medical underwriting, and it's called a guaranteed issue period. So if you qualify for that, which is good to have, you don't have to worry about what your health condition is. Mm-hmm. You can choose from any of the supplemental plan options that we went over in part 1 of this series. Okay, Medicare supplemental plans guaranteed issue. I just mentioned that word. There are several other guarantee issue situations you can roll into, and that's the loss of coverage, or you moved into a different area. So I know Cece has a Medicare supplemental plan, if I remember correctly. Yeah. So if she decided that she was going to move to her son's, who lives in a completely different state, she would have to get a new supplemental plan.
Oh, okay.
Okay, because it's going to be, I got all kind of, can you stop me for a second?
No, it just keeps going.
Oh, I guess I had all kinds of crazy stuff going on my computer right now.
Oh, sorry.
Okay, I'm sorry. Okay, I got it off. Okay.
Okay.
All plans have options, as we talked about in part 1 of our series here. And okay, let's go on to the next slide. I apologize for that, but everybody, okay. Star ratings. Star ratings are really important, okay? Star ratings have these different key factors. Star ratings are 1 to 5. This talks about member satisfaction, surveys, plans, providers. So when you get your survey that says, how do you like this? How do you like the medical? That's real important. They do performance measurements that are based on 50 key factors and additional information that you'll find on Medicare.gov. Those 50 key factors change on an annual basis. So the carriers is always moving. The mark is always moving. So they don't, from one year to the next, they don't know what those marks are going to be. So they have to be on their feet. Those star ratings are really important. I like to work with star ratings of plans that are 4 and above. I don't know if the next slide shows this. Okay, let me go. Okay, so it's just 4 and above. Because I know with those star ratings, they're getting, there's money involved with the star ratings. So the different plans can offer you different things at the higher star rating. A 5-star rated plan in your area can sell Medicare, their Medicare Advantage plan all year round. And it's pretty hard to keep that 5-star rating because of those key factors changing. Let's pass over the COVID information.
Okay.
So this is really interesting here. This is my service to you. If you do contact me, I will, and you don't live in my area that I work with or I have a license with, I will help you find someone in your area, because my brokerage group will help me out to help you find that. Anybody who is a broker like I am, we have to spend about 80 hours every year going through testing, okay? You have options. So these are the different options that are available. We talked about Part C plans, it's a Medicare Advantage plan. We talked about Medicare supplemental plans. We talked about what if you're still in the military, you can continue with what you have with the military. And if you're still working, and I work with people constantly that are still working, or all of a sudden they're finding out maybe their plans are costing with their employer more than what it's costing them to go on to a Medicare Advantage plan or a supplemental plan or a prescription drug plan.
Mm-hmm. Yeah, so it's really good to just call you and tell you what you have and what your needs, what you're anticipating your needs to be. I think that's the crucial thing, is to try to figure out what your anticipated needs are. So like if you're going to have a hip replacement or a knee replacement, or if something's going on, you need to start analyzing what your cost of for your insurance is going to be.
Well, like knee replacements and things like that, surgeries, mm-hmm. I really can't help them out with that. But if all of a sudden they've been diagnosed that they have a heart condition, mm-hmm. depending upon the area and where they live, there could be a specific plan for that. If all of a sudden they've been diagnosed with asthma or COPD, some kind of a pulmonary problem, depending upon the area, there could be a plan that's out there for them. If all of a sudden you go in and they say, well, now you're a diabetic and we need to put you on medication, okay? depending on, again, on the area that you're in, there could be a plan out there for you. So the same thing if you've been diagnosed with end-stage renal disease, which is the kidney dialysis,
Right.
or you're having a kidney replacement. There should be something out there to help you, and no matter what area you're in. Okay, it just all depends upon the situation. So, but if somebody diagnoses you at this point with some form of a cancer, that may not qualify. Okay.
Mm-hmm.
All right. Because I have somebody to say, well, I have a chronic cancer. Well, that doesn't get them qualified.
Right. Yeah. But the best thing to do is, if you don't know, ask. Right.
Yeah. I'm more than happy to ask. This last year, I have helped more people go from that are 70 years old or above, and they've still been working. Their employers have helped them out. Okay. And all of a sudden it's like, okay, I have to pick up insurance on my own.
Yeah.
So or you may find out, especially the first 3 months of the year, that your medical group doesn't take your insurance anymore.
Oh yeah, that happened to me.
Yeah. Okay.
It's like, what? Well, one office would take it and the other office wouldn't take it. And what happened was my doctor moved to the other office, which is just a few miles down the road.
Right.
And they didn't take my insurance anymore. So I had to get a whole new doctor. So yeah, which I actually like better. So
I mean, that happened a lot this last year, like the very end last year of the annual election period time. It was like December 1st or something. We found out that this one medical group wasn't going to take an insurance carrier any longer. And it was like scrambling.
Yeah, this is
to get them changed. All right. And then, of course, there's that 3 months at the beginning of the year, if you have a Medicare Advantage plan, where you can get that worked out.
Right, right.
And it's real crazy when that happens. So it's real important. One of the things I didn't talk about on Medicare Advantage, they can either be, depending upon where you live, and that's the important part of this, is that they can be HMOs, they can be PPOs, they can be something that's called point of service, POS. There's a couple of other things out there that you can have. You just need to work with an agent or myself to find out what best suits your needs. And that's one thing, that's when you work with a broker, you find out that a broker, they're going to be paid no matter what you select. And one of the things I like to talk about is that no broker should charge you for a consultation. Mm-hmm. It should be free. So when a broker comes to see you, you make sure they do an assessment of what your needs are. Make sure you have your medications ready for them. Know the names of your doctors when they're sitting there and working with you, because it's going to help out. Of course, you know what zip codes you live in, and you need to have that Medicare card out for them. And then they can go from what there for you to select what it is you need to have.
Great advice.
Really, yeah. So we didn't fill that out, so we could take that off. Okay. Oh. Okay. So it's real important. So I just want to say, which I said in the part 1 of this series, is that you really do want to make sure that if somebody calls you on a phone and they didn't give you permission to call, don't talk with them. Mm-hmm. Go back and find someone that you trust that you can talk to. Because if they don't know what your needs are, because they can say to you, oh, we have a plan that's going to pay you $125 back every month on your Part B. before you do that, review those benefits, understand. But the first rule which should be, don't talk to them on the phone. If
Yeah.
you haven't contacted them, don't call them. But if you've given them permission to call you, remember who they are.
Yeah. Write down the information. Yeah, I think that's really good advice because, number one, you don't know who they are if they're calling. So, and you're giving them personal information when you start to talk about this kind of thing. So it's better to make sure you know who you are calling. So it's better that you call them. And of course, if you're in California, you can help them, right? So
I can help them totally in California. I can
yeah,
help
so
them
in
out a lot.
California.
Now, if
So
I get a lot of phone calls, maybe I'll think about picking up that license in your state. But but I can definitely help you out and get you to a qualified agent.
So just Janice at benefitsforyou2.com, and her website is benefitsforyou2.com. That's benefits, BENEFITS, for the number 4, you, and then the number 2.com. So very cool. And then again, if you have any Medicare questions at all whatsoever, she's got a special number for you. It's 747-205-4364. 747-205-4364. So give her a call if you got any questions. This is very important. I didn't realize, I will tell you, I just didn't realize that it was as complicated nor as important as it is. But as I start to get older, I start to realize, I need to definitely have somebody that I can trust to talk about these things with, and then start to work it out, because it can cost you some severe money. And so you need to, and the other thing is you want to make sure you're getting the right care, right? So you want to make sure that your benefits are going to allow you to get the care that you need as you progress in your latter years of life. So it's very, very important.
So there's one thing I didn't see. Oh, it should be up here. Is that
right.
my license number is up above? Okay.
Okay.
So, yeah.
So you have your license.
It's real important. And I just, all these benefits, every January, everything starts over. Doesn't matter if you have a supplemental plan. It doesn't matter if you have a Medicare Advantage plan or a prescription drug plan. And there's a lot of extra benefits. So I tell people, review with your agent. May it be over the phone, may it be on somewhere where we can talk with you on Google or Zoom. There's ways that we can do it where we don't have to come to you, or we can make an appointment and meet with you. Okay. It's important that you review your benefits on an annual basis, because things change from one year to the next year. The benefits change. The extra benefits change. A lot of people don't realize what those extra benefits are. And then I'll see somebody who I haven't seen in 5 years. Well, I should have seen you before this. I didn't know. Because a lot of them, especially in the MAPD plans, the Medicare Advantage plans, they have a lot of over-the-counter. It changes from one year to the next.
Mm-hmm. And now is a perfect time, because what you said, open enrollment is October 15th through December 7th.
Yes.
So now is the time to make changes if we want to make changes. So now is the time to start talking with a professional like yourself and figuring out what our needs are for the next coming year. So yeah, I agree.
And you don't have, right now, from October 1st to October 14th, if you don't think you're going to change your plan and you just want to review it, your agent can do that. But if you decide to change your plan, they can't do it until the 15th of October.
Right.
And you have until the 7th, of December. So that's a 7-week period. So some of the information, if you're watching part 2 on Medicare, please go back and watch our part 1, because it's full of good information. And Cece, thank you so much for doing this with me.
Well,
because
thank
this is
you.
so
I thank you for having your show. You have a weekly show that you do, and I thank you for that because there's a lot of great information, a lot of wonderful guests that you bring on, and then this one taking the time to truly explain this very complicated anything that has to do with insurance and money and all of that becomes very complicated, and so you make it very easy to understand and of course available to talk further if we need that. So thank you for that. I appreciate you.
okay. Well, thank you. I love being on your network, and I wish I could talk about other stuff, but I'm not allowed to mix it when you do Medicare.
That's true. That's true. So again, Senior Citizens Forum show with
Thank you.
wonderful Janice Wood. Thank you so
Yeah,
much.
this is WGSN-DB going solo. Thank you very much for watching. And if you have any questions for myself concerning Medicare, or you're interested in more of Cece's shows, please contact her. Thank you.
Bye.